have to say, I'm so impressed with the Children's Law Center. One of the largest organizations, the largest organization, as I understand it, for kids in the District of Columbia. Amazing. And as I understand it, DLA Piper had something to do at the beginning. We offered some space. Its genesis really came from DLA to a certain extent in those early days. But now to be serving 2,000 kids every year, the impact on those kids and the chance they have, and the opportunities that you're giving them is incredible. And so when Judith was kind enough to ask me to come, it was an easy yes. But I have to say, there are a lot of dedicated people tonight, and who are here, and I just want to thank each of you. You know, every country starts at the base of the pyramid and they work their way up until, guess what, the money runs out. In the United States, we start at the top of the pyramid and we work our way down until, guess what, the money runs out. And so the challenge of this transformational time is to, at least for now, assume we're not going to have a system, but determine that we can create a marketplace and this collage in a lot more efficient manner with a new infrastructure that allows greater efficiency and greater opportunities for better outcomes than what we have now. And really, if we're not going to at least, we'll never start at the base of the pyramid and give up that technological advantage, but we've got to figure out a way to cover the entire pyramid and get to wellness, which is something we haven't been able to do. And that's basically what we're trying to do here. And what I think is really encouraging, and this is probably a surprise to a lot of people, what's encouraging is that there's a lot of agreement among Republicans and Democrats and conservatives and liberals about our current circumstances. There is no disagreement that we have cost, access, and quality problems. There is no disagreement that the causes of those problems are in part a fee-for-service system that drives volume, that we have a lot of unnecessary care for a lot of reasons, a lack of coordination among our subsystems, that we don't have any transparency, that we are still a paper-driven. We have a 21st century operating room and a 19th century administrative room. All of those and many other factors drive the fact that we have these problems. And I think the most amazing thing is that today, I would say that there's even agreement on the goal. That we want to produce a high-performance, high-value healthcare marketplace with better access, better quality, and lower cost. Better outcomes. That's what we're looking for. And so, in the search for better outcomes, there is a realization that today we're not getting what we're paying for. We spend more than the next 10 countries in the world combined. We spend about $9,000 for every man, woman, and child in the country. And it goes up every single year, not as much in the last 2 years. We're not getting what we're paying for. And not only are we not coming out in the top 20 in virtually any one of the criteria for performance now, but there are some places that are even worse than others. And unfortunately, even though in the district we don't really have an access problem, we have a serious quality problem. And that quality problem affects these kids. When you're 48th in the country when it comes to low birth rate, when you're 49th in infant mortality, when you're first in the number of newly reported cases for HIV, you got a problem. And we have a problem here in the District of Columbia. So we really have two choices. We can keep doing what we're doing, or we can take this transformational moment and really see if we can come up with better paradigms for better outcomes. And that's basically what we're trying to do. And one of the exciting things that I find about the Children's Law Center is that you didn't need the Affordable Care Act to come up with an idea that has already begun to produce extraordinarily better outcomes. And what that is simply a partnership between medical and legal experts. Creating better health by creating a better health environment. And in creating a better health environment, a recognition that there are a whole new set of opportunities there that never really existed until this partnership came about. And that's what Healthy Together is all about. I mean, I was just talking to a couple of these fantastic doctors you got, and they were just saying, you know, we're actually integrated right into the clinic. We work next door, right next to the next desk to the doctor. And we try to work out through a better appreciation of what are our options here that go way beyond just what health issues there may be for a particular child. Maybe it's home-based problems. Maybe it's the larger issues involved in that child's life and family. But it's working out and realizing that prevention and wellness go hand in glove with better outcomes. And prevention and wellness is not just something that comes with another immunization. And so I am thrilled that Healthy Together is doing so well. So well, as I understand it, you're considering doubling your budget to be able to address the challenges that you know exist right here in the district, if that's right, Judith. And so I just applaud you for that. You know, the bottom line is, at the end of the day, if we can make a better life with better outcomes, what better way to assess our impact and the value of our work than that? There's a lot of doubters. There's a lot of division in this country about the role of government and about whether or not, at the end of the day, we could ever possibly reach out to every child who needs it in the District of Columbia and take this paradigm and maybe even replicate it in other parts of the country. And I don't blame the doubters. I don't blame the naysayers, because there's a lot of reason to be skeptical. But you can't talk to these lawyers for more than just a couple of minutes and know they're not on to something. So I have a couple of heroes that I love to quote, because in this transformational time, there's a tremendous amount of uncertainty. There's a tremendous amount of concern and anxiety. But boy, there's a lot of opportunity. My first hero, Winston Churchill, said something that I know you will all recognize and probably have used, that Americans will do the right thing after they've exhausted every other possibility. We've exhausted virtually every other possibility in trying to achieve better outcomes. My other hero in this context is Nelson Mandela. And that read his autobiography, Long Walk to Freedom. It's one of the best autobiographies you'll ever read. But he used to have these debates with his cellmate, who insisted that apartheid would never end in South Africa. It was simply impossible. Mr. Mandela would say to his cellmate, well, many things seem impossible until they're done. It may be an impossibility for some to touch the lives of more kids, not only in the district but all